morning. The health care bill is in large part similar to Obamacare in that it keeps its basic structure, but it does eliminate a number of its components. And so for some conservative Republicans, it doesn't eliminate enough of them. For some moderate Republicans, it eliminates too many. And under the basic outline that we've been able to tell here, the bill ends the main Obamacare requirement that everybody has to have health insurance. It ends the mandate. Of course, that could also mean that fewer people buy in. That could increase costs for others. The bill offers tax credits to help Americans buy coverage. It, however, scraps the subsidies to lower costs. And so, again, for some, especially lower and middle income people, costs could actually rise under this bill. It rolls back the Obamacare expansion of Medicaid, even perhaps more severely than the House version did, but it does leave in place protections for people with pre-existing conditions.
Let me ask you this. I have two questions, Aaron. First of all, how is this being received? And second of all, is this a bill that is going to be jammed down, America's throat as a political move at the end of the day along partisan lines?
Well, it's a good question because I think the calculus from Senate Majority Leader Mitch McConnell is even with an imperfect bill that doesn't satisfy everybody, do you really want to be the Republican senator that scuttles the 7-year promise to get rid of Obamacare? The question, though, is whether this bill actually does it. It's really interesting because this doesn't seem to be the kinder, gentler bill that President Trump was talking about when he was talking about having the bill having heart,
healthcare with heart
of the House bill, right?
Right.
But this also isn't a wholesale rewriting of the nation's health policy around free market principles or state by state experimentation. It as I say does leave the Obamacare structure in place. So in some ways it doesn't satisfy any of the requirements. But what it does do, however, is it does come with a kind of a rationale of lowering healthcare costs in order to make some tax breaks, and that is certainly in line with the Republican priorities.
The whole notion that the Republicans use these days in railing against Obamacare is that premiums have gone up, and they have, and I've felt it myself. On the other hand, as you noted, if you take away the mandate and you leave in place the pre-existing condition contingency, the economics don't work. How does the Senate plan keep those costs down under those circumstances?
Well, but they do it by getting rid of the expansion of Medicaid, and they also reduce the subsidies. And this may be the most fundamental difference between the House and Senate bills. The House wanted to end need-based support provided by Obamacare. The Senate kept the framework, but it provided less money than the current Obamacare agreement. And it also allows a number of the states to opt out, to waive restrictions, loosen their local insurance markets, and that's the only thing there that is different from the House version is that, as you say, that pre-existing condition requirement. But it would let states decide whether insurers should be able to charge more for people with higher health risks. So they could charge up to 5 times more money.
Who's in and who's out right from the start in terms of senators lined up with or against the bill?
Well, there's 4 more conservative Republicans, including Rand Paul and Ted Cruz, who say that the bill just doesn't go far enough. Rand Paul called it Obamacare light. You have more moderates, such as Susan Collins of Maine, who say that they're concerned that the bill goes too far and doesn't insure enough people. And we'll wait for the Congressional Budget Office to score it to see whether it will mean that 20+ million, like the House version did, would lose insurance, possibly.
The Majority Leader, Mitch McConnell, has said he's going to bring this up for a vote before the July recess. How likely is that?
About 50-50, we're told. Mitch McConnell is determined to bring this to the floor before the July 4th recess, and so he must have some internal calculus that thinks it can pass. But still, the Republicans can only afford to lose two, and right now they have more than that who publicly say they're opposed.
Aaron Katursky, ABC News correspondent from New York City, thank you so much for bringing us up to date on this.
Thank you.